Rachel Vi, and this is my presentation on encephalitis lethargica. So, how has EL been understood? The word lethargic stemmed from the word forgetful. Encephalitis lethargica has been described as the greatest medical mystery of the 20th century. It's also been described as sleeping sickness due to the symptoms that which people appear to almost look like zombies and can sleep for months. Encephalitis itself is defined as inflammation of the brain, which can be caused by viruses, bacteria, fungus, autoimmune diseases, and medication. EL has thought to have appeared in the 1600s, but was first defined in 1917 and basically disappeared after 1940. There are three forms of EL. The somnolent form is the sleepy form, which is characterized by nonspecific symptoms such as malaise, headache, and mild fever. Patients get increasingly tired and eventually fall into a deep sleep. These patients are easy to wake up, but however, once they do wake up, they can quickly fall back into a very deep sleep. 50% of the somnolent patients will die, the other half will wake up. The hyperkinetic form is characterized by twitching, muscle jerking, anxiety, severe muscle pain, and insomnia. The mortality rate is higher than 50%, and people who have the hyperkinetic form often progress to the somnolent form. However, those who start out as the hyperkinetic form and progress to somnolent have a higher chance of survival than those who just start out with the somnolent form. Those with the hyperkinetic form also experience problems with their eye muscles. The amniostatic kinetic form is characterized by the symptoms of both of the previous forms. So they experience muscle weakness and muscle rigidity. The symptoms often resemble Parkinson's disease. They will not have any tremors while moving, but only at rest. They experience excessive sleepiness and insomnia. They have ocular involvement and often ptosis, which is a drooping of the eyelid. So, what have people thought caused EL, and how has that changed over time? The leading hypothesis in the past was that it was caused by Streptococcus bacteria or the herpes virus. But the three main thoughts was that it was caused by, number one, toxins. They thought that toxins in the air could have caused the epidemic in the early 1900s, which is very similar to the miasma theory that we talked about. However, this was ruled out as the epidemic was worldwide, so it didn't make sense that the same toxin could be causing this disease across the world. The second thought was infectious disease with a virus or bacteria, supporting the Streptococcus theory or the herpes virus theory. The third thought was autoimmune disease causing the epidemic, which doesn't necessarily make sense, and there are very few examples of an autoimmune disease that is in an epidemic form. The current thought on what caused EL is that we really still don't know. Most recent evidence suggests that it's caused by an enterovirus, as those who had EL had traces of enteroviruses on them. However, we still just simply don't know. Has there been any change to the way that EL has been defined? So at first it was mostly just defined as being incredibly sleepy, and we have added more symptoms to that list. However, we still are just mostly unsure about the cause of it and why people experience different symptoms than others. The main change to the way that encephalitis lethargica has been defined is that we've added symptoms such as oculogyric crises and obsessive compulsive behavior. Have different symptoms been attributed to EL? Yes, a lot of different symptoms. So the symptoms of regular encephalitis, which to reiterate is just swelling of the brain, include headache, fever, confusion, vomiting, side effects based on where the inflammation is in the brain. So for example, if your frontal lobe is swollen, you're going to experience behavioral effects. The symptoms of encephalitis lethargica are almost specific to each individual case and are extremely personal. It affects everyone different, it seems. But mainly, people become paralyzed or unable to move or speak, but are completely aware of their surroundings. They can see, hear, smell, and can basically just hear everything that's going around them. They know what's happening, then they know that this is happening to them. Those who contracted the illness are affected long after they contract the disease. They experience symptoms that are very similar to those who have Parkinson's. Children who contract the disease experience immense behavioral changes that are caused by their frontal lobe swelling. They often experience suicidal and even homicidal tendencies. There was one case of a little kid getting it and having really difficult impulse control issues. In the middle of the night, they plucked their right eyeball out. After receiving treatment for that, they continued to pluck out their left eyeball just because of the swelling of their frontal lobe. How has this disease been treated by the medical community? This disease was much more focused on from 1916 to 1924, when there were 5 million cases worldwide. What's so interesting about this disease is at one point there were 5 million, and we've only had 200 since 1940 at this point. We have studied extensively, basically up until the 1960s, because we were still seeing cases by then, but at this point, there's really no reason to study it further, except for the concern of it coming back. But with not many people going through it right now, there's really no reason to study it. So it has been mostly forgotten. What treatments have doctors prescribed for encephalitis lethargica, and has this changed in any way over time? In the past, they would mainly just prescribe supportive care because that's really all they could do for these people, because they couldn't reverse their paralysis or any of their other symptoms. So really all they could do was provide intravenous fluids, a feeding tube, and help them breathe when they got to that point. They found that a caring and nurturing environment helped, so basically hospice. There was a facility called Mount Carmel where those with post-encephalitic symptoms lived. The people that lived here were described as forever young, as since they were stuck in there and since their EL paralyzed them, they couldn't make any faces. They couldn't move their facial muscles. So these people had absolutely no wrinkles and looked much, much younger than they actually were. More recently, we have found a drug called levodopa, or also known as L-Dopa. It was discovered to be effective for Parkinson's symptoms and was seen to be almost like a miracle drug for encephalitis lethargica. However, this did not last. They found that basically too much of L-Dopa would cause really bad side effects and too little would have almost no effect. The last known patient who had EL died in 2002 after 50 years in a long-term care facility, being essentially asleep. So how has this disease been understood or viewed within society, and has this changed over time? In the pandemic in the 1920s, people thought it was related to the Spanish flu, another pandemic that they were going through at the time. This was mostly because those who had encephalitis lethargica also had a high chance. There was just a high chance in general of getting the Spanish flu, so those who had it could have had it already, but it wasn't the cause of it. Today, most people have not heard of encephalitis lethargica, thankfully, because we don't really have to deal with it anymore. We have a greater understanding of the different symptoms of the disease now, although we still don't understand the cause. We don't understand why different people experience different symptoms, but we do have that knowledge of the different symptoms and of how this disease acts. So although encephalitis lethargica is an incredibly interesting disease, luckily that's all it is to us now. We can just talk about how interesting it was and how strange, and hopefully we'll not have to encounter it again. Here are my references, and I hope you enjoyed my presentation.